Vijayashree Natarajan. I recently completed a certification course from my son, teenager son, on wellness, mental health, and how we should be as a parent, how we should not be pushing them for, he's entering into his 12th standard, so his school reopened few days back. So he was actually giving me and my husband for a 1-hour lecture on how wellness is important, mental health is important, and on one side as a mom, it was increasing my BP, but on the other side as a technology leader, I was really happy to see the Gen Z, the next generation, and their awareness on wellness, right? And he was actually giving me a lecture, how much of protein he should take daily, carbohydrates, magnesium, potassium, the entire chemistry class he took. So probably in our generation, our moms used to tell us, this is good for health, you eat. We are in a different generation where the kids are actually teaching us what is good for us to eat, what is good for them to eat, and what should I pack for the lunch and also. Thanks to the technology and thanks to the advancement of AI, and this was my personal experience. As I said, I have to wear two hats, one as a mom and the other one as a technology leader. Okay. So today's topic is on the wellness, the revolution. As I was saying, in the conversation I had with my son at home, I thought it was a revolution which is happening around wellness. And obviously the advancements in the technology, all this AI, Gen AI, what you would have heard throughout the day in all of these sessions, right? The technology is really helping us in many ways, especially around the wellness. And what I will be covering, I would like to cover, while we might have heard about the wellness, all our Apple Watch, all our monitoring mobile apps, which is actually helping us to monitor and we can actually take care of our health and the wellness. I just want to touch upon the back end side of it, how AI is actually helping in the healthcare industry. And I come from an healthcare industry where I head the technology practice for Omega Healthcare, where we serve the providers in the US healthcare industry, right? So there are three stakeholders is what I would like to cover when it is around the healthcare, the patients, the providers, the hospitals, the payers and the insurance. And the AI plays a role across all these industries, because obviously the more anything in healthcare is towards the patient and for the wellness of the patients, or I would say the patient-oriented care, right? And how much the technology is helping behind in the healthcare on the provider side or the payer side. Because these advancements in technology, obviously, when I say payer, it's on the insurance provider. The technology should help them to, focus more on patient-oriented plans and other stuff. Similarly, the hospitals need to have advanced technologies, right? So, just we'll touch upon how AI is playing in all these, across these stakeholders. When I say patient, when I take patient, the patient-oriented care, the new paradigm in the industry is actually the health informatics. You actually get data around. Earlier we used to call it as personal health information, the PHI data in healthcare. Now all the PHI has become, I would say, public health information, right? So the data is actually floating around everywhere, and it is easily available, and it is shared across your providers and all your information. That is actually helping helping a shift in the, I would say, that industry where a new paradigm is formed, a health informatics, and how this data and the AI is actually used across these paradigm, right? And more and more, the application of this AI is actually helping the patients. For example, it can actually help in preventing your disease. It actually, for example, today morning I was in a flight, and after half an hour, I got an alert in my Apple Watch saying that you have been sitting and you need to stand actually, right? So it is actually helping me, and I cannot stand in the flight. But that's a beauty of technology, how it is actually helping you to be, taking care of your health when you are actually on your travel or on your business travel or on your meetings, right? So all this data which is being collected, and all the hospitals have become smart hospitals. There is a concept called Internet of Medical Things, which is an advanced, I would say an advanced way of Internet of Things, where the data from the different sources, be it your smart hospitals, be it your own mobile phone, which is tracking your health, similarly what your smartwatches, all this information is actually helping in preventing the disease for a patient. So that's one, I would say, a good use case for AI, where your AI kind of a technology can be applied to take care of your health, right? The very good example on the medical imaging and the radiology side, where AI is actually helping in improving the accuracy of all your medical scan and other stuff. So we might not be knowing the software or the AI algorithms behind all those medical equipments which you might be seeing in the hospitals, right? But there are AI algorithms which are running behind those systems, which is actually helping, and all those advancement in technology is actually helping in improving the accuracy of the results. This is an industry where you cannot afford to have false positives or false negatives, right? The result has to be accurate, because you are actually kind of finding out about a disease, or the results have to be accurate, and it has to be 100% accurate. So these AI algorithms are really helping in doing I would say, a back-end job. Provider industry, as I said, the second stakeholder, the hospitals. Predominantly, on the back office side, the AI is actually being used to take off all the administrative cost for the providers. When I say administrative cost, do the work, the hospital systems do the work, the way they do the work. In the case, we call it as a revenue cycle management, where the overall collections of the providers, how we can actually cut down the cost by applying your AI technology, automation technology. So the more the hospitals become cost efficient in their cutting down their administrative cost, they can actually fuel in that investment for more of their investment on getting a better equipment for the hospitals, and also for more R&D work for the hospital. So another advantage I would say on the technology for taking care of all your administrative work, where you automate, you bring in AI technology, the claims, what you submit from the provider to the insurance, and how quickly you can actually get it reimbursed from your insurance provider, right? So the moment when we step into an hospital, we would expect us to be discharged as early as possible, and we don't need to wait for the insurance to be reimbursed. And that's one scary thing whenever we enter into the hospital, right? How much, because of the administrative burden, you end up in spending more time in the hospitals, right? So the technology helps in removing the unwanted administrative task behind, so that the hospitals can actually invest more on getting an advanced equipments, focus more on your research and development, so that it can actually provide more patient-oriented care rather than spending more money on the unwanted things. The third stakeholder, the insurance stakeholder, the payer industry, and obviously they play a major role, because unless you get your insurance reimbursed by the payer industry, the patients are going to get different problems. We might have stepped into an hospital for a different problem. On seeing your bill, we might be getting a different problem on seeing your overall hospital bill, right? So the payer industry is completely transformed using technology. Now they have actually applied technologies like AI, where they can provide more value-based care plans. When I say value-based care, it's like a very specific category for specific, kind of sector of people. And how can you arrive such a value-based care for a payer industry? And obviously, you will have some historical data. And healthcare is a field where there is huge amount of data available in the industry, right? So you can actually make use of all that data which is already there and apply all your AI technologies. It can actually help in kind of giving you very good insights, predictive insights, which the payer industry uses for creating the value-based care for the patients, right? And one of the biggest challenge for the insurance industry is also the fraudulent claims. This is predominant, especially in the US healthcare, where not a real claims would have been submitted for, for the reimbursement. So, obviously, AI kind of a technology helps in preventing this fraudulent claim submission, with which the payer industry can actually improve their overall the business, which can finally fuel into creation of more patient-oriented care or the value-based care. And the last item is your understanding the populations, meaning you have lots of claims data, you have lots of clinical data coming from the patients, and you can actually create more risk stratification strategy with which the insurance companies can actually create more value-based plans. For that, they need to understand the different categories of the population, right? And where they need to actually fuel in more plan. So that is a big area where AI is actually playing a major role. These are all some of the back-end examples where the technology is actually helping the entire healthcare industry so that we get the best out of care. The last but not the least, the impact of generative AI, I think she covered beautifully explaining the different, the bias in the Gen AI and other aspect, right? In fact, I had a when you were asking a question, I was about to, we had a different experience with the Gen AI when my team started playing around with the chat GPTs. We were trying to build a medical coding platform. So we have some platforms which takes care of predicting your CPT, ICD codes. So we were actually trying out the LLMs with the GPTs. We didn't get any response, like a biased response, but we got a very weird response for one of my architect. Suddenly for one of the prompt, it actually gave a beautiful paragraph about Elon Musk. Totally irrelevant, nobody in the prompt was not asking anything about Elon Musk or anything. It was an healthcare specific question related to the project which the team was actually trying to attempt. In fact, it made us really revisit our LLM strategy. Should we really need to depend on this? Because if I'm betting on building a product with this LLM models, and if it is suddenly giving me an beautiful poem about Elon Musk, which is nothing to do with my platform which I'm building, that's the experience we had with our GPT, I would say. But it has, I think now they have actually taken care of all the security measures. So how is Gen AI impacting, especially in this healthcare, and whatever I was saying, all the AIs, some of the challenges we would have faced using just an AI technology is all getting, I would say, resolved by the generative AIs. And one very good concept which we started using is applying AI for AI. How is AI, Gen AI is actually really helping some of the problems of the AI world. Meaning, earlier in the AI, we used to have lots of, we need to have huge amount of data for training your AI models to get the required accuracy. Now the Gen AI is actually helping to do a better training of my AI models as well. That is one. Number two, it is also helping to get rid of this traditional AI models. You can actually start using your pre-configured or pre-trained LLM models. So that is two. The third point which I would like to highlight, this is one of the quote which was, I recently attended the NASSCOM event in Mumbai, and there was a fireside chat with a Philips head of innovation person. I think if I remember his name was Vijay. He was actually quoting a beautiful example how Gen AI is being used in Philips in their equipments. For the mammogram machines, it all has the AI algorithms behind. As I was saying, healthcare is one industry where you cannot afford to have a false positive or a false negative. It has to be 100%. Nobody would prefer to get a false positive or a false negative result of a mammogram. So there are AI algorithms behind the Philips mammogram machines, and all the typical the scanning of mammogram. This algorithm takes care of finding out the result. It is helping the human to find out the result. So he was actually giving an example how earlier, before these Gen AI's days, they used to have some false negatives or positive because some of the patterns of the tissue which they are trying to use it in this mission, it may not have been trained by the for the AI model earlier. If it is totally a new type of pattern or a tissue where the AI model would not have been trained, there is a possibility it would actually give a less accurate result for the mammogram result. So they have actually applied Gen AI technology to find out before giving a patient's data into this AI model, to find out whether this AI algorithm has been trained with that pattern earlier. If it is not trained with that pattern earlier, they would skip the AI model. They would directly, bring in the human to do. It was a beautiful example. I never thought of, or probably I might not have understood the value of AI helping AI unless you get a real healthcare example of how it is actually helping a mammogram. I thought of repeating the same statement which he was making in that event. I thought it would be relevant for this event. So that's all I have for this, and this is not something new. You guys would have heard about AI, Gen AI throughout the day, and this is how it is helping us in the wellness. This is Vijayashree and Natarajan signing off from you all.
Thank you so much, Vijayashree. We are open to take